Once we take a biopsy, and if there's cancer, the next few slides I'm going to walk you through Gleason grade. And this is the most common question I get. Explain to me what the Gleason grade is. And I'm going to take some extra time and explain it to you so that hopefully everyone can understand this. If you have cancer, the tissue is going to be extracted, and then that tissue is sent to a pathologist. A pathologist is a doctor that looks at that tissue under a microscope and tells us whether there's cancer or no cancer. If there's cancer, they will give it a Gleason grade. Okay, this was developed probably 30 or 40 years ago by Dr. Gleason at University of Minnesota, and it's a good test because I know it's very predictive, but it's been around for 30 or 40 years. We have not found a better test or better way to identify prostate cancer than the Gleason grade. So this is well vetted information, and it's a good technique. The way the grade works is you're scored basically 1 through 5. 5 is the worst, 1's the best, and I'll talk about 1 in a second, but it's a score of how good or bad your cancer is, and that score tells us how to treat your disease. Okay? Grade 1 and 2 we don't really use. It's historical. It's fallen out of favor. We really only use Gleason grade 3, 4, or 5. 1s and 2s no one calls anymore. They're probably not cancer. And this is what the pathologist sees. Okay? You don't have to be a doctor or a scientist to figure it out. It's pretty obvious, and that's the simplicity of this, why Gleason grade has stood the test of time. Grade 1 and 2, let's start with grade 1, is how the prostate should look. Uniform glands are all tightly packed, and that's what a typical prostate gland looks like. If you go to grade 2, you see the glands get further separated or more space between the glands, and then grade 3 is where we see cancer. Grade 3, you see infiltration of the cells, and it looks different. Again, you don't have to be a doctor to see this. Grade 3 is a lot different than grade 1. So the glands aren't as tightly packed, they're infiltrating, they look different, and then as you go from grade 3 to grade 4, you get irregular masses of cells with few glands, you don't even see glands, and then grade 5, you don't see the glands at all. And that's a common theory of or thing we see with all cancers. As the cancer gets worse, it doesn't look like its original tissue, okay? So the grade 5 cancer doesn't even look like prostate glands. It's totally different or differentiated, so it's a very aggressive disease. So again, 5 is the worst, 3 is the best. These are all different grades of prostate cancer. What you'll see is we'll give you a score. If you have prostate cancer, you guys might have seen this, it'll be 3 plus 3, 3 plus 4, 4 plus 3. And the way that works, and this isn't brain surgery here, it's not rocket science, the first number is what the pathologist, the guy looking at the slide, sees. The first number is what he sees the most of. So if he says you're a 3 plus 3, if he says you're a 4 plus 3, the first number is what he sees the most of when he looks at all the cells. So that's the majority of the cancer he sees. The second number is the second most common cancer type you'll see. So if you're a 3 plus 3, you pretty much just sees 3s across the board. If you're a 3 plus 4, you mostly under the slides have 3s, and then there's a few areas of 4, okay? And that's how you get the Gleason grade. You take those two numbers and add it up. So basically, guys today diagnosed with prostate cancer will be a 6 through 10, 6 being the best, 10 being the worst. And with that, we've just recently changed how we graded it and made it even simpler, that we put them in 5 groups. So grade 1 prostate cancer is Gleason 6, and that's the new grading system. It came out about a year ago. Grade 1 is 6. Grade 2 is a 3 plus 4 equals 7. Grade 3 is a 4 plus 3. Grade 4, again, this isn't brain surgery. Grade 4 is a 4 plus 4 or an 8. And then grade 5, which we rarely see, thankfully, is Gleason 9 and 10. So you're basically, when you meet with your urologist, and unfortunately if you're diagnosed with prostate cancer, he's going to put you in a grade 1 through 5, which is basically a simplification of the Gleason scoring system. So the question was, how does the pathologist determine the 3s versus the 4s or the 5s? There is subjectivity to it. It's one guy or he or she looking at it, a specialist, a pathologist, to determine is it a 3 or 4. So there is, I agree, there is subjectivity to it, and sometimes we'll get second opinions or ask other guys to look at the slides. But when you look at that data, when we get second opinions, most pathologists today are very good at calling it. And that's why we still use Gleason score, because it's pretty easy. You know, I'm not a pathologist, but they're pretty uniform from pathologist to pathologist in what they see. But there is, I agree, there is some subjectivity, and if there's a question mark, it's not a bad idea to ask your urologist to get a second pair of eyes to look at it and see if he or she agrees with the initial diagnosis. We'll do that a lot. Or if you're in a community where there's not a high volume of prostate cancer being diagnosed, it might not be a bad idea to send it to a tertiary or a larger center where you can have a specialized pathologist who's used to seeing a lot of prostate cancer take a look at it. But even in those settings, you don't see, it's shocking, it surprises me, there's not a lot of variation between different guys reading it. It works very well.